Well, the country is in talks with 9 vaccine manufacturers, including AstraZeneca and Pfizer. Well, speaking of AstraZeneca, the British pharmaceutical giant gives the Philippines the green light to purchase more vaccines, on top of the 2.6 million doses earlier procured by the private sector. Let's get more on this new deal from Presidential Advisor for Entrepreneurship, Joey Concepcion. Joey, thank you so much for joining us on the program. So tell us, who will be covered in this second batch of vaccine doses? Because the first procurement was 50-50 for the government and the private initiative.
Well, the tripartite agreement stays even with the second part. No? The government basically, we will be purchasing the vaccines from the AstraZeneca, and we will be donating the 100% to the government, of which part of the tripartite agreement states that 50% of the vaccines will be for the use of the donors, their employees, but following the same protocols, the frontliners, no, as well. No? So nothing changes from the tripartite agreement. In fact, the tripartite agreement can be used in future with other vaccine manufacturers as well. No?
So does the AstraZeneca deal, Joey, cover the transportation, storage, and the distribution costs?
Well, there's a certain small amount there that covers the transportation. But for the logistics here locally, I'm not sure about that. But that's still going to be discussed. Secretary Charlie is calling for a logistics summit, I think, this coming week. No, so that will be addressed there, and that will be. We have enough time to prepare because these vaccines is scheduled to arrive May onward, May, June onward, thereabouts.
All right, 2.6 million doses for the first procurement. Do you already have an idea what this second batch of how many doses it will include?
Well, we're getting a lot of calls. We're helping Astra put this thing together because we have the network, and hopefully we can come close to what we did in the first round, so that we'll hopefully get to about 5 million. We will do our best because I believe that the private sector plays a very important role here in opening up the economy safely, and I think the vaccines very clearly provide that solution to this whole effort now of opening up the economy.
But Joey, AstraZeneca withdrew its application to hold trials in the country. Will this have any kind of impact on the timeline and the deal for the country, which you say would this first batch will be here by May or June of next year?
No, the trials are not mandatory, as DG Domingo stated in his interview, and it was never a mandatory thing. AstraZeneca has completed its trials, phase 1 and 2 and 3, and it doesn't mean that they can't do trials in the Philippines later on. They can still do that, but for now, they are not going to do it. So DG Domingo has stated that these are not mandatory. What's very important is that the UK government grants, the MHRA, which is the version of FDA, comes out for the use of AstraZeneca, so that the FDA, our own FDA here, can give approval to AstraZeneca to be used in the Philippines. No?
All right.
So then the government can place their order once that happens.
All right. Vaccine czar, Joey, Carlito Galvez said they're finalizing this week negotiations with Sinovac for its vaccines. The Chinese drug maker vowed to supply vaccines by April or maybe even March. Why isn't the private sector involved in this deal when AstraZeneca is only arriving in May or June?
Well, AstraZeneca has this zero profit. No? As you know, the price is about $5 per dose, and they approached us. And most of this AstraZeneca's program is really basically being sold to the government through us. Now, what we are donating through the government, basically, we purchase from Astra, we donate to the government, and the Sinovac, I'm sure it's also basically a G2G at this time. Most countries are G2G, especially the year 2021. No. But with this effort of AstraZeneca and us donating to the government, it allows us to be able to use 50% of that for our own employees. So it's a great formula for us to have access for use of our own employees. If not for that program, we will not be able to have access of the vaccines for our employees.
Joey, the Pfizer vaccine has already been rolled out in the UK, and it'll be rolling out this morning as we speak across the United States. Is the private sector and the government getting any closer to a deal with them?
Well, my view there is that they are a lot of countries have really placed their deposit with Pfizer, and I don't think they have any program that's also for zero profit. No? So Pfizer is an American company, so their priority is to help the American citizens, from the way I see it. No? And but I think Secretary Charlie Galvez is trying to approach all vaccine suppliers. And I think I would agree that our best bet would also be Sinovac, because of the president's relationship with China. So I think that, to my view, Sec Charlie will get better inroads with the Sinovac vaccine. And there are rumors that a lot of people have been using it here in the Philippines.
Thank you so much for your insights on the vaccines. Joey Concepcion, Presidential Advisor for Entrepreneurship.